Hi, my name is Greg Garber, and I am the Administrative Director of the Division of Supportive Oncology at the Sidney Kimmel Cancer Center at Jefferson Health in Philadelphia. And today I will be talking to you about medical marijuana 101, what to know, where to go, what we are learning. Here are my disclosures, some grant research funding. So today's talk is really going to be kind of a broad level overview to kind of level set people's knowledge of medical cannabis, cannabinoids, and other associated things related to that, assuming that there is a fairly low level of knowledge amongst the general population. So want to create some base for that. And certainly there are many additional questions which will be raised by this talk. And I included my email on the cover slide, so do feel free to reach out. I'm happy to help. So we're going to just do an overview of kind of what this looks like nationally, go through some terminology, going to dispel some myths that people may or may not have heard, going to go over the evidence, and then some of the nuts and bolts of the products and how they're administered and labeling, just to kind of differentiate this from what people are familiar with when they walk into a regular pharmacy. And then some things to consider for your own use or further questions. So thank you all for joining me today, and let's get started. So here's a current map, and this map has changed many times over the past number of years. As of right now, there are 3 states that do not have some kind of cannabis program, be it adult use or recreational, medical, or a third type, which is a low THC or CBD program, which you can see in the light green. And so this map is getting greener and greener over the years, with New York and New Jersey coming to the fray. Recently, other states moving sometimes from medical to adult use. Many states have both. Some states just have medical, but have legislation pending for adult use as well. So just to kind of give you an overview there. In terms of terminology, medical cannabis is a program where you need to be certified by a professional, usually a physician, but it can also be in some states a nurse practitioner or others, or physician assistant. With medical cannabis, there are often low or no taxes on the products that you buy. And in some states, there are higher quantity limits. This is a real state-by-state program, so there is no one kind of hard and fast rule, other than in states with adult use, or recreational as some call it, you need to be 21 years old to purchase it, and taxes can be very high. These are excise taxes, or sin taxes, people say. They can be anywhere from 15 to 35% and more. So those are the main differentiators. In states where both, if you have a medical card and you go into the medical side of the dispensary or a medical dispensary, it will save you some money. Quickly, people use the words marijuana and hemp and cannabis and CBD and all kinds of things in a variety of different ways. Essentially, marijuana is anything of the cannabis plant that has greater than a 0.3% THC content, and hemp has less than 0.3%. And a bill called the Farm Bill a number of years ago legalized hemp production. Hemp can be turned into a number of industrial and food products, building products, many things, and is a cash crop that is legal throughout the country right now, and the CBD can be derived from that. Here's another way of kind of representing that, with cannabis on top as the genus, and then there are 3 different species of cannabis: Cannabis ruderalis, which you do not see much; Cannabis sativa; and Cannabis indica, which are what most people hear of. Products with a lower percentage of THC can be in any of these, and they would be called hemp. If they have more than 0.3%, they're called marijuana. Just a little pictogram here of kind of the uses of both of these. Hemp is grown throughout the world. It is a taller plant. It often cannabis is bred for hemp production. So lower THC, more fibrous plants, which lend themselves better to industrial usage and in a variety of different industries. Marijuana is, with higher THC contents, is bred for bigger, larger flowers, which can be turned into a variety of different products, including just drying the flower itself. So the primary cannabinoids that we're going to be talking about today, and I think that kind of limiting the conversation here does make some sense because it can get overwhelming. There are many, many different chemical compounds in the cannabis plant that can have physical and mental effects, and they interact with cannabinoid receptors in your cells. There are over 100, probably closer to 130 that we know of, cannabinoids found in the cannabis plant. And the two most common are THC, as we all know it, delta-9 THC, which is the primary intoxicating cannabinoid, and CBD, or cannabidiol, which is the primary non-intoxicating cannabinoid. And certainly an oversimplification, but for our purposes today, I think that will help us. Just another pictogram here of a number of the cannabinoids, both on the non-psychoactive and psychoactive side. People will see these sometimes on labels, on products that they are buying, and this is kind of a nice representation of some of the more primary ones. Terpenes, another word that people hear a fair amount when they're talking about cannabinoids. Terpenes are chemical compounds in plants that give it a certain smell or taste. So when somebody is telling you about a terpene profile they like, they are talking about this, and they're listed right here with their names, and from piney to lemony to vegetal to herbal, and underneath it, it tells you some of the effects. We don't really know. We're just learning about these things. And so if somebody tells you, if you always take this kind of terpene, you're going to get this kind of effect, there may be some evidence to support that, but we're not really there yet with kind of understanding all of the implications of all of the terpenes. And these are natural compounds that occur within the cannabis and many other plants. So another kind of level setting thing, our bodies have what's called an endogenous, we have a endogenous endocannabinoid system. So we have receptors throughout our bodies that can bind to cannabinoids. Those are naturally occurring. We have those. Unlike opioids, which bind to the nervous system, cannabinoids can bind, as you can see from this map, all throughout the body. So in your joints, in your organs, in your CNS, many, many different places, which is why sometimes a local application of a cannabinoid can be particularly helpful, or some cannabinoids have an affinity for one of these two, or there are other receptors as well to be helpful with a particular condition. And so there's a little where these are located are kind of listed next to the pictogram, and of course I'm sure you will have access to these slides. Few other things just to put out there. Under the Farm Bill, which legalized hemp, the market out there has been dramatically changed, which probably many of you have seen. You can buy CBD and all kinds of different products in gas stations and health food stores and many, many places. Kratom is one of these that you will see. It's an herbal extract that comes from an evergreen tree. And delta-8 THC is another compound that comes from cannabis. We know very little about these. We know little about the production of some of these things. There is very little quality control. So I would caution people from buying things like these in places that are not reputable, where they do not have some kind of certification of what they actually contain. There are some scary effects that can happen, and best to stay with things that you are buying from dispensaries or reputable producers. Just in terms of risk briefly, the graph on the left here shows you the poisoning deaths for various drugs, with opioids being at the top and cannabis at the bottom, just under Tylenol. The graph on the right So also says essentially the same thing, that cannabis is the least dangerous of the recreational drugs. The main danger is kind of smoking too much and getting too high, or falling asleep, or if you're unstable on your feet, obviously not getting in a car. But since it is not a central nervous system depressant, the risk of stopping your breathing or your heart is almost non-existent. Um, People have heard cannabis is a gateway drug. Largely not. That is not true. There is a slightly higher risk of dependence if you are younger than 25, but once you are after 25, the risk is essentially zero, unlike many of these other uh, products that you see above it. Cannabis does have a little bit of a withdrawal syndrome for some people, but it is not a life-threatening one. You can be a little more anxious, sleep can be a little more difficult for a couple of days, but it is not something that needs any kind of treatment. So the bad, as I mentioned earlier, anybody who has kind of smoked too much or used too much cannabis or took a couple of edibles without waiting for the first one to work could tell you that it could make you very anxious. You could become intensely high. You could feel panicky. Some people can develop psychotic symptoms. This is often naive users in unfamiliar situations without proper education about this. People can have some short-term memory disruption, reduced ability to focus, sleepiness, and rarely there's something called cannabis hyperemesis syndrome, which can happen in very heavy cannabis users where they have kind of intractable nausea and vomiting, and will sometimes show up at the emergency room and nobody knows what that is. And it can very well be hyperemesis syndrome from cannabis if they are heavy smokers. Two of the ways to stop this. One of the ways to stop this is to reduce the amount of cannabis you're using. And another thing that people do is take hot showers. And for some reason that helps to relieve the symptoms. Don't see it too often, but something to pay attention to. So research, kind of this is why we're here. This is where we're at this conference. We want people to have the best kind of evidence that they can have as they make informed decisions about any kind of treatment or testing or medical care that they are getting. Unfortunately, cannabis research in the US is very, very challenging and only getting a little bit easier, very little bit easier over the past couple of years. Because the states have individually legalized and built programs doesn't necessarily mean that research has kept up with that. Cannabis is still federally illegal, and it's a Schedule I drug, which means it has no useful purpose. Most of the studies on cannabis are observational, so there are surveys, focus groups. Some states do allow for more rigorous research and can do some randomized blinded studies, but it's still not the gold standard of medical research of a randomized, blinded controlled trial. So we are not there yet. Getting an FDA permit to do research in the US is difficult, although it is getting a little bit easier. However, the US grows its own supply of cannabis, which doesn't mirror what is available in the commercial markets. And so you're not getting necessarily an apples to apples comparison. This is improving, though. Much of the research that we have has come from other countries that have considerable cannabis research portfolios, including Israel, Czech Republic, the Netherlands, Uruguay, and Canada, and others. So let's go over the evidence here. And certainly there are many, many studies, many of which are done are lab studies. They're not necessarily in humans. They could be done in labs and lab animals. But this is pretty much, as of right now, a synthesis of what we know. There are many people out there who will tell you they have had very different experiences with very different things, and would disagree with all of this entirely. And truthfully, that is fine. But in order to give people really good guidance about what is going to be helpful with what, we certainly have to advance the research. There is good evidence that cannabis can help with pain, can help reduce, eliminate, sometimes helps people reduce opioid use. There has been some data to demonstrate that. There have been some population-based studies looking at Medicare Part D claims that have shown that in states where cannabis is legalized, that opioid claims for Medicare go down. So again, it's not causation, but it's interesting and certainly reason for further study. We have certainly seen in our practice at Jefferson that patients who have chronic pain are on opioids and start cannabis, and if it is helpful for them, they'll often come back and report that they have not stopped their opioids, but they have reduced them. I don't know that expecting cannabis to be a replacement for opioids for really chronic intractable pain is probably not realistic. Chemotherapy-induced nausea and vomiting, there's good evidence for this. It works for that. However, not for prevention. Many patients use it for prevention and swear by it. We just don't have the evidence to support it yet. Doesn't mean you can't, doesn't mean it doesn't help some people. Just that's kind of where the evidence is. Anybody who has ever used cannabis would probably attest to the fact that it does make them hungry, and that trips to convenience stores and eating ice cream and all kinds of zero calorie, zero nutritional value food becomes very enjoyable. However, there is no evidence or very little good evidence that says that it will help you gain weight. It certainly can help improve appetite. There is evidence to support that. It can help make food taste better for people who are on chemotherapy or have other things that are affecting their taste, head and neck cancers and things like that. It may reduce weight loss from cancer treatment, but it hasn't been shown to make patients gain weight though. One of the most important things about this though is it is safer than virtually every other drug that is used to help stimulate appetite. So if it does help people maintain their appetite and hopefully, if for them it helps them gain some weight, it's certainly a reasonable approach. There have been some studies on neurocognitive dysfunction from chemotherapy, chemobrain. Some animal studies have shown improvement with CBD, so that is the non-psychoactive component of cannabis. It doesn't appear to worsen cognitive impairment when used for other symptoms, such as pain, although acutely may impact your cognition, as many who've used it would attest to. So it doesn't seem to be harmful. It just doesn't seem to be particularly kind of helpful in the long run either. However, this is an area of inquiry that needs further study. Anxiety and depression. So the jury's out. High THC products certainly can worsen anxiety. Being too high does not typically relieve people's anxiety. There is some evidence that high CBD may help with anxiety and insomnia. And some decent studies out of a number of different countries showing that. And however, no kind of solid recommendations with regards to that. If you go into dispensaries, you will see things labeled for sleep with a compound called CBN, which is a cannabinoid that is related, related to CBD. Some people think that is sedating. There is some evidence to support that. Not an unreasonable thing unreasonable direction to go. There is no good evidence to treat depression with cannabis. We have a whole variety of highly effective antidepressant medications and therapies that work for depression. This would never be a place that we would start for this. If people feel they've gotten the benefit for their depression by using cannabis, okay. But if somebody came into us and said that they were feeling terribly depressed and wanted to try cannabis, it certainly would be something we would discourage them from. Insomnia, little evidence that marijuana helps with insomnia in patients with cancer. Some evidence that high-dose CBD, as I said before, more research. And despite this, however, many patients frequently report using cannabis for sleep. So take that for what it is, that maybe they found kind of the right blend, the right amount, the right thing, or maybe it's their biochemistry, or maybe it's a placebo effect. But we certainly hear patients year after year who come back to see us who say that this is helpful for them for sleep. So So the Holy Grail, and we get this question in our center quite a bit as well. Is there evidence that is there a reason I should be taking cannabis to treat my cancer? And while there is lab evidence that some cannabinoids have anti-tumor activity, this has not been translated into benefits for humans. So we tell people, listen, we have no evidence to support that this is going to be helpful. It's probably not going to be harmful in most cases, but it's not any reason to forego standard of care, evidence-based cancer therapies that are known to be efficacious. So, fingers crossed, maybe, hopefully we will find some application for this, and these lab studies will translate into something that works in people as well. A little bit on routes and dosing here. So the fastest way to get a benefit from cannabis is to inhalation. So either smoking the flower product or the buds, or vaporization, which is cannabis that has been extracted from the flowers and has been dissolved in an oil, and it's heated to a high temperature and it creates a vapor. It gets inhaled, works within minutes for many, many people, lasts for 2 to 4 hours. It's also good because you can titrate it that way. You can have an inhalation, you can wait 10 or 15 minutes, you will know pretty much how it's going to affect you and decide if you would like to have more. Oral or ingestion, people who've taken edibles, gummies, things like that, will tell you that can take quite a long time for those to work, anywhere between an hour and 3 hours, sometimes a little less. So if you're looking for instant relief, if you're nauseated, if you're trying to stimulate your appetite, probably not the best way to go. However, it is longer acting, and the measurements of the dosages of them are measured, and if you're not making them yourself at home, you're buying them in a dispensary, you are pretty much knowing what you're getting. One of the dangers of this is somebody takes an edible and they do not wait long enough before taking another one, and they both hit them, and they have overshot, as we say. There are tinctures and other products that you can put in your mouth, a spray, drops, a few other preparations. They work a little bit faster. They get absorbed through your mucosa. And so about 45 minutes for that. And they have kind of an intermediate. They work about 4 to 6 hours. And then topical, which is in our clinic, tends to be a very popular product that people can put topically on really any body part. Arthritis in hands, some people use it for neuropathy. That works in, usually shorter rates. 120 is long, but usually, 10 to 15 minutes, you're starting to feel something. We don't know much about peak effect or duration of effect. There are different topical preparations, and we usually tell people, although no evidence on which this is based, is that the goopier, the better. So the more something is like a balm than a lotion, the better it's going to kind of adhere and not kind of get rubbed off or washed off. So we think that probably makes some sense. On the right is essentially a little bit of what I just said, although I will point your attention to the starting point for most ingestible products that contain THC is 2.5 milligrams. So you want to pretty much stick with that until you kind of know more about what you are able to tolerate. That is roughly equivalent to about one short 2 or 3 second inhalation from a joint or a pipe or a vaporizer. So these are inexact because the strengths of vaporization are very different. You can have a product that has 5% THC and one that has 35% THC, and certainly those are going to be different. How do you guide a patient? One of the things I will tell you is that the standardization that exists in a retail pharmacy we're nowhere near close to that in terms of dispensaries, both recreational and adult use in most states. So where you see on the bottom right here, the tincture, the 1-to-1 CBN to THC, which is a tincture made for sleep, that tincture has 3.4 milligrams of THC per ml, which is essentially a dropper full. On the top left there, that tincture has 33.6 milligrams per ml. So one dropper full is going to put you way over where you want to be. And paying very close attention to these products. The guidance often in dispensaries, while it can be very, very good, these are retail establishments, and these are commercial products. And so a little bit of buyer beware in asking about the potency of things. The potency of flower is expressed as percentage of THC. On the bottom left is a vaporizer pen. That doesn't mean that you're getting a 74.66% inhalation of THC. That's the concentration relative to the volume. You can do some math and figure out roughly what an inhalation would equal, but usually 2 to 3 seconds of an inhalation with most available vaporizable products are kind of the starting point. Labels, not going to go into a whole lot of detail here, but all cannabis products sold in dispensaries in our country are labeled. They're analyzed by labs at a couple of points, usually during their production, and the labels will tell you the compounds that are present in them. They're often very small. They can be hard to see. They can be difficult to decipher. As you see on the top right there, you can see how much THC is in that and how much CBD, and then there are a number of other cannabinoids listed, and some terpenes listed as well. Not terribly meaningful numbers. Again, for our purposes, looking at the THC, looking at the CBD are going to be what the most helpful things are. The other thing I will tell you is that a lot of packaging, the label exists only on the package. And so when you take the product out, whether it's a vape cartridge or something else, you are going to separate it from its contents in terms of knowing what's in there. So it is good to keep the box, the product package that something came in. It's not across the board true, and there are efforts to correct that, but it is an issue. All vape cartridges look alike in Pennsylvania. So if you take them out of the box, they all look exactly the same. You have no way of distinguishing one from another, unless one is branded, but each brand makes many, many different ones. Another label here, just to point out, so that this is a chocolate bar, and the chocolate bar has approximately 100 milligrams of cannabinoids. So 5 milligrams, there are 20 servings, approximately 5 milligrams per serving. But you need to drill a little bit down more, because that is not all THC. That is this is roughly a 1-to-1 or 50-50 THC CBD blend. So one serving is going to be about 2.5 milligrams of THC and 2.5 milligrams of CBD. So labeling has a little ways to go. Also, the THC CBD ratio is not standardized. Sometimes it's first CBD, sometimes it's first THC. So just, you want to pay attention to that. And just kind of in finishing up here, things to think about. Do you have a reason to medically prefer a specific form? Do you not like inhaling? Do you not like, feel so nauseated that you don't want to eat something? Do you, is your pain just kind of superficial in one area? That can be something that guides selection. Again, focus on THC and CBD alone for right now. We really don't know enough about anything else. We think about broad strokes. We think THC predominant products, CBD predominant products, and hybrid or intermediate products. So when you're ingesting something, it's either milligrams or ratio. So if you had a tincture, you could have it be a 5 milligram per ml tincture, or you could have it be a 1 part CBD, 1-to-1 tincture, which is 1 part CBD to 1 part THC, or vice versa. It'll tell you the concentration of that as well. Inhaled is almost always a percentage, whether it is in a flower product or a vaporizing product. How experienced are you with marijuana? If you have not done it before, low and slow, as very, very little at first, and you can go up from there. Always easier to kind of add more than take it back once you've done it. And just one last slide. So it doesn't look like on the left, and it doesn't quite look like on the right, but it looks more like on the right than on the left. So it is often overwhelming going into dispensaries. There are many, many products. They are very slickly packaged and marketed and labeled. And so you can often get help in a dispensary. You can often find some help on some online sources, but your best source is speaking to somebody knowledgeable about this, um, and and you know, speaking with friends and looking at discussion boards as well, wherever you may find information, because we kind of are at that stage right now where anecdotal and experiential stuff can be helpful as a starting point. So thank you so much.